So we are going to start our instruction course on the Smart Eye Clinic. Basically, it's based on how ophthalmologists can use their smartphone in their daily practice to take images, to calculate their IOL power or do a measurement of the visual acuity or any of those things, and how all our instruments can be used for patient counseling. So initially we have Dr. Prasanna Venkatesh Ramesh for his 3D 4D resident fellow pedagogy.
I would like to start off with a demo in my smartphone. Yeah, I'll try to stick to the time and finish it off quickly. So this is, can you see the slides here? This is now my smartphone so this is a benefit of the videographer. Is the video on? Video is on, superb. So this is my phone that you can see. So this is the recent app called the IMG Max that we have done. So for the benefit of the viewers, I just wanted to do the demonstration here. You can see that this is one of the first apps in ophthalmology where I'm using my finger here. You can see me on the stage moving the face. This is subtractive learning, my dear friends. In textbooks, you don't get subtractive learning. You can actually remove structures where you can see me now removing the skin. Now I'm touching the skull and removing it. Meninges, brainstem, brain. You can selectively remove structures and then you can rotate, go into the structures in whichever frame that you want to. And this is something that we want to give the neophytes so that they don't have any blind spot. We have added so many layers. If you want only the nucleus, the nerve and the extraocular muscles, you can have only those layers and you can study only those layers. So this is subtractive learning at its maximum. So the same thing in AR mode with good lighting, you scan the environment. You can see that my fellow colleagues Dr. John and Dr. Hirika are also there in the background. The same concept with a good lighting, you can also have it in augmented reality. So which I'm finding it difficult to do, but this is, my dear friends, you can see this will not give any blind spot to the user or the pedagogue, where he can go into the eye and have a good evaluation or good idea of what the sub concept is. So yes, some of this which you'll all be knowing is the Iron Man, who first started using the holograms. And was it science fiction? No, it's a science-based reality. We have done a patent for this, and these are the six innovations or the journey that I would quickly touch upon in a single minute on each. So initially it was always animations. Me being a glaucoma person, you can see the iris process and the peripheral anterior synechiae on the right. So I started making animations like this and then took my residents or the neophytes into real-time scenarios. So this is the iris process, which is fine and arborized. This is more broad basal, where the IOP will get increased. And this is why do we do a pupillary blockers. The block happens here, the aqueous is not able to go through like this, so it pushes and the effect happens here. So simple concepts. Why do we do a YAG PI, and what is glaucoma in a single minute? So for me, if I have a moving image or a video, I felt the concepts were much better highlighted. This is a single minute video, my dear friends, where you can see the increased vertical cupping. So the 6 or 7 points in glaucomatous damage, like you can see, then I zoom it in more, having the glaucomatous cup with an inferior notch, then slightly zooming in and showing the non-specific bionetting sign. Then the basic sciences of inferior is slightly lesser than superior. The ISNT rule is breached in this patient, then showing the RNFL, so that is the structural defect. Then in the same patient, the visual field is brought on top and the corresponding superior arcuate scotoma is shown, followed by the OCT of the same patient. Transparency is reduced, the inferior RNFL defect and the ganglion cell layer defect is noted. So this is how we started our animation journey. The channel is there. Currently we have around 1600 subscribers. The channel goes under my name, and we have made a lot of animation videos. ALPA, argon laser peripheral iridoplasty, how does it happen? So these are things that we don't need to mug up. In cataract, simple cataract extraction, how the iris falls back, how the ciliary body falls back after lens extraction because of the iris plateau diaphragm shifting backwards, how the scleral spurs falls back, how there is a breakage of peripheral anterior synechiae. So the more we started making animations, the more we felt that we need to make the unanimations, which was the second part of our particular thing. And we started making the models, template, the eyeball, the circle of Willis. We started making it digitally in the third dimension, and we launched an app with buttons. So this was the first prototype which we launched in the Android platform with the buttons. So we didn't know how to go with AR, so we thought we'll have a buttons. The user can click the buttons and go into any frame of choice. This is a dynamic app. It flows dynamically without, just not like a book. Vitreous on and off, silicone oil. And you can see that you can also use filters, like you can have the fundus with different pathologies that you start seeing in a OPD with color fundus, autofluorescence, infrared and whatnot. So this is the deck that you can start collecting multitude of patients. You can just keep on adding, and then we launched the Windows version. So that was the innovation 2.1 of the same. Moving on to the third was the augmented reality. Today, if you have an Android phone, for the people who are looking in this video in YouTube, you can go to App Store, or rather this is an Android where you have to go to Google Play Store and click EYEMGAR. AR is for augmented reality. And you can see this is my friend here, also my research and team partner, Mr. Aji. He is demonstrating the holograms in the smartphone of an Android phone. You just need a Nokia 7.0, which is available in every smartphones today. So he's demonstrating how in real time an optometrist, a paramedical, a first year postgraduate, or any neophyte can see the retina for what it is, can see the iris or the angle for what it is. And this is again the smartphone video of the same, explaining complex structures of the angles, as well as you can see the splinter hemorrhage, RNFL defect, and the any cases you can have, any views you can have. That brings us to the fourth innovation, innovation 4, which we are currently working on very aggressively with simulators, EMR as well, where my fellow on the right, he seems to be moving through thin space, but he's actually seeing the patient's anterior chamber angle. He's using his hand tracker to actually expand through it, examining the fundus and so on. Even if you have an anterior segment imaging tool, you can have your own OCT filter. This really helps in training for hydrodissection versus hydrodelination when there is a posterior polar component. You can customize training. The kids nowadays, this is my daughter, she's very well oriented with this technology. I feel this will be the future where we'll have to train, we'll have to just bring these products into the market so that the next generation will have a much better time by learning through these kind of pedagogical tools. So then we also had this 3D printed circle of Willis, cavernous sinus. This was just an additive of reality that we wanted to add with the feedback we got from the senior teachers and so on. And the last one is the touch, which I demonstrated the first. This was a recent innovation where we had a 3D view and an AR view. We wanted to give the user the freedom of subtraction. So this is again a very, very important one, I felt, because we want to have only selective structures seen. Let the user decide what structure he wants to on and what structure he wants to off. So by doing that, we give the user a complete freedom on choosing the structures, and the virtual dissection is also possible just with the fingers in this particular app. So, and this is in 3 dimensions too. I call it maybe the pseudo 4D. I learned this word yesterday actually. It's more like a 3.5 version or a pseudo 4D, where it's technically where you use your finger. That's where you can see that you can use your fingers, move into it. And this is the brain that you can see on the right. We have a brain model which is completely anatomically read, and this is a very well scientifically proved and validated model. 3 models have been available in the app now: a brain, an eyeball, as well as the whole neuroanatomical artery, venous and nervous complex. So these are 3 available. We have also done a simulator, a smartphone simulator. In your phone, you just need to open this. Yeah, I'm completing in 30 seconds. So you take your phone into the pupil, just like how you take your direct ophthalmoscope forward, you can go as a simulator. So this, how it helps is left hand, right hand, ambidextrity. In the initial stages, we all use only one hand to see the fundus. So can we use both the hands the day one itself and use it, and then also for e-counseling? So that was a part of these kind of innovations. and we do have a good amount of downloads. We have around more than 1000 downloads in Android, and this is one particular app that is picking up very well, which was recently launched with more than, again, 700 to 800 downloads. So this is the metaverse that we have created, and our software is a translational software, not an imaging one. In 60 seconds it gives you the holograms, and we all serve the community to a large extent, be it the medical fraternity community, our peers, or the students, or even for the patients. I think this will serve as one of a new cutting edge tools, and with that I would like to acknowledge my team. It's a team effort always, and this is the QR code for the viewers who are seeing this. If you have missed my previous slides, this is the QR code. You can have all the 6 innovations today. You can go home, or whenever you are seeing at the comfort, do download these innovations, utilize it, give your feedback. That is how we can make the next innovation possible, because each innovation was the feedback that was given by the previous innovation, with which we developed the other innovation. So I would want more feedbacks so that we all can innovate, keep innovating more. So most of it are published. Also, you can read it, except the last one, which is not yet published, the IMG Max. And thank you, Kerala, for having me, Prithvi, with the Kerala flavor. So I did have some of the good images in the proceedings book as well. So we are a moving image department, and I hope you loved these images, these images as well, the iris, the one on the beach, and the other things. So we work a lot of images, and once again, thank you, Prithvi. Thank you to one of the persons I really look up to is, again, John sir, and also the young brigade, Hirika. So with that, I also thank the audiences on a Saturday morning. 2-3 people are here. You made us not talk alone, and thank you for being here. It means a lot. Thank you.